Mr. Chairman and Honorable Committee. My name is Haley McKee. I am a co-chair of the Substance Use Policy, Education, and Recovery TAC. I'm also a community outreach organizer, aka peer recovery coach with the local recovery organization. And first and foremost, I'm a person in long-term recovery from substance use disorder. Representative Caldwell just actually told my story, and it's not unlike a lot of other people's stories that are struggling to recover from substance use disorder. My problems also started in pharmacy, and eventually led to heroin addiction, and I'm just grateful to be here today. I'm here in support of H5184 because as a peer recovery coach, I can see both proposed regulations having real-world applicability. Working with individuals with acute substance use disorder, I often witness instances where CFR 42 Part 2 creates loopholes within our prescription monitoring program, and consequently, individuals are able to access or acquire medically assisted recovery, which is methadone and Suboxone, emergency medical care and medications, illicit substances, and narcotic prescriptions from regulated prescribers, all in the same day. Our systems are currently quite siloed and do not talk to one another, potentially putting people, particularly those with polysubstance abuse dependence, at risk of overdose. Most of these individuals are scared and they're fearful of overdosing. When made to feel comfortable or cared about, sometimes these individuals will ask for help. Signage at a pharmacy could potentially provide a non-verbal segue to a conversation that should change someone's life. I believe that pharmacists have a bigger role to play in this epidemic, and that the small consultation cubicle off to the side of the register should be an outlet for individuals to ask for resources, talk about their concerns before beginning to take these potentially addictive medications with medical professionals, and communicate if they have become dependent on them. Accurate messaging is to the potential dangers of these medications to keep patients aware of any potential drug interactions. And also, this is the reality of how many people's stories start in their journeys to addiction and hopefully recovery. And as for the second part of this bill, in regards to the partial fill, just recently I took part in a meeting along with 10 other people who work in the field as social workers, case managers, and mental health clinicians. We were collectively discussing an individual who's on methadone, uses cocaine daily, and is prescribed over 60 benzodiazepine at a time. This individual had expressed that they didn't want to be issued the whole script at once, citing concerns that they did not have a safe place to store their medication without it being stolen, and that they also they did not trust themselves to not take them all at once. This person was practicing what we call recovery in moderation. And while it might not be as ideal as an abstinence-based recovery, it is a common method within our active use community that has been effective in prolonging people's lives in the hope that these people will recover. So collectively, between this group of 10 people that are immersed in recovery services, we came up with some of the worst ideas and solutions for this person to store their medication properly, such as leave it with their partner that was also a person living substance use disorder, storing it at a different community organization where they have to go every day to get a regular dose, which is kind of also inappropriate. And it wasn't until about 10 terrible ideas and 10 minutes in that somebody at the table, who was a pharmacy technician, had also actually brought it to our notice that there was partial fill in place in our pharmacies now. And as field experts and people that work in this, we had no idea. So we can only imagine how, if it was a layperson that was acquiring their medications from a pharmacy, how in the dark would they could potentially be as far as having this essential service in place. So we live and breathe this, and we were unaware. A person without a team is probably going to certainly be unaware of this possibility. A person that's trying to exercise harm reduction or keep a narcotic stripped out of the hand of a child in their house should also be aware of the fact that the pharmacy can hold their medication safely. I say this is an incremental change. It's not going to fix this epidemic, unfortunately, but more incremental measures that we put in place to positively put reinforcements to come at this from all angles, I think it does potentially have the chance to save Rhode Islanders' life just based on the lethality of our substances and potential drug interactions. So thank you for your
Thank you.